Hello, my name is John Din, and our group will be serving the 4th and 5th graders of the Boys and Girls Club of Inland Empire, along with my team members, Julius and Mary. This group is about evenly split between male and female. The girls are described to be more extroverted and rambunctious, while the boys are more reserved and quiet. The number of children attending the Boys and Girls Club each day can vary, depending on schedules and parent availability, but we will have a max of 20 per their policy of one staff member to 20 kids. The group as a whole tend to have strong personalities and stand by what they believe in, even if they're wrong. They perform well academically, and their reading levels are up to standard, but they can be quite cliquish and reactive towards one another. During our needs assessment interview with Mr. St. Augustine, who represents the Boys and Girls Club of Redlands, he expressed he would like us to work on their attitudes, getting to know each other, and having to redirect them less. He explained he would like to see more fun-based academic programs. They continue to employ programs implemented from past LOU collaborations. And a big plus he mentioned is that the curriculum was easy to follow so that any staff member could run it without issues. From our literature review, we cemented that the role of OT in mental health with young adolescents is for practitioners to help facilitate in identifying and implementing healthy, positive habits and structure into their daily routines by providing education and implementation of skills related to social competence, such as making and keeping friends, coping with anger, solving problems, learning about social etiquette, and following school rules. Studies suggest that supporting participants to become involved in extracurricular activities can have benefits for their mental health, and these benefits are in part due to an increased sense of belonging. Studies have shown evidence of self-esteem improvement programs enhancing self-esteem and peer attachment in elementary school children. These self-esteem programs implemented helped acknowledge the peers' names and increase their connections. Thus, the program we have created, which we have named and identified as the 7 C's, will be addressing 7 key components to self-esteem and peer attachment, which include communication skills, connection, caring, confidence, courage, celebrating others, and citizenship skills.
For our program model, we chose the PEO because it emphasizes the relationship between the person, environment, and occupation, which can affect the overall occupational performance. For the 4th and 5th graders, assessing their performance components would be assessing the person in the PEO model. So for this group, the performance skill that would need improvement would be in their communication and interaction skills. For their environment, we would focus on the social environmental factors, which would include their social groupings, attitudes, and behaviors. For the occupation, we would assess activities and tasks. An example of this may be a lack of social participation. For our overall program goal would be to increase self-esteem and reduce social anxiety to facilitate healthy social participation in 4th and 5th graders at the Boys and Girls Club of Redlands. Our weekly objectives would be, by the end of week 1, 100% of the 4th and 5th graders at the BGCIE will demonstrate 3 positive communication skills with their peers to facilitate healthy social relationships. The followings would be also demonstrate 3 strategies to cultivate connection with their peers, demonstrate 3 caring relational skills, share 3 strengths to facilitate confidence, demonstrate 3 ways to show courage, demonstrate 3 ways to celebrate others' strengths and/or accomplishments, and lastly, demonstrate the ability to receive constructive feedback with a positive attitude as part of their citizenship skills. To measure our weekly outcomes, our program, we will have the 4th and 5th graders complete a pre and post self-esteem assessment. The pre-self-esteem assessment will be taken in the first week, and the post will be in the 7th. We chose the Piers-Harris Self-Concept Scale because it assesses self-concept in children and adolescents. It can be used to monitor change in self-concept over time.
We will involve the organization in the implementation and evaluation process by providing our curriculum to staff members ahead of time for their review so that they can get a sense of the journey we will be going on with both them and the kids, and so we can get their feedback. While implementing the program, we will involve the staff members to actively participate as we work through each weekly objective, which will foster further rapport and build relationships with the kids. Following each week's session, we will seek constructive feedback from both the kids and the staff on what went well and what can be improved. In order to ensure the participants' needs continue to be met after we leave the agency, we will provide the entire user-friendly curriculum for the staff to use in the future. We will also provide caregivers with OT-based resources designed for them to facilitate the 7Cs at home to ensure consistency and promote carryover. And lastly, we will foster continued collaboration with the Boys and Girls Club by building meaningful relationships throughout the program and modeling skilled intervention strategies to continue building on the foundation of trust and collaboration already fostered by LOU students who have gone before us. We will also make each session fun yet impactful so as to attract other kids and families from the community. This concludes our presentation for the 4th and 5th graders at the Boys and Girls Club in Redlands. Thanks for watching.